The primary evidence in a hanging is the ligature mark. It presents as a defined groove or furrow in the tissue. Post-mortem, the mark becomes yellow-brown and parchment-like upon drying. The mark can also retain the specific pattern and texture of the ligature material. A thin line of congestion or hemorrhage with abrasions along the groove edges strongly suggests antemortem suspension. In a classic hanging presentation, the ligature is situated strictly above the level of the thyroid cartilage, following the 80% rule. The trajectory is oblique, directed upwards toward the knot position. At the suspension peak, the main force pulls upward and away from the skin, resulting in a classic inverted V at the knot site, leaving no mark at the extreme apex. While horizontal marks strongly suggest ligature strangulation, they can appear in hanging under 3 specific conditions. These include the use of a running noose, a low point of suspension with limited drop force, and postural leaning in partial hangings, where the body's position creates a transverse mark. Partial hanging means the body is only partially suspended, with the toes, feet, or knees touching the ground. The victim may be sitting, kneeling, or prone. Importantly, the total weight of the human body is not necessary for a fatal outcome. The weight of the human head alone, typically 5 to 6 kilograms, can provide sufficient constricting force to occlude vital neck structures. Partial hanging creates a hemodynamic trap. The low tension easily occludes superficial jugular veins, blocking blood outflow at approximately 2 kilograms of tension. However, deeply protected vertebral arteries remain patent, requiring massive force, about 20 kilograms, to occlude. Blood continues pumping into the head, leading to intense engorgement, a swollen, dusky purple face, and pronounced petechial hemorrhages. Judicial hanging follows a specific protocol: preparation, drop distance calculation, and knot placement. The rope length is mathematically calculated based on individual weight, build, and age, allowing a drop of 5 to 7 meters. The knot is critically placed beneath the chin in the submental position to induce a biomechanical force that forces the chin sharply upward. Death in judicial hanging is primarily due to biomechanical shock. The sudden stoppage of the moving body at the end of the drop, combined with the submental knot, violently jerks the head backward. This results in the hangman's fracture, bilateral fractures of the C2, C3, or C4 vertebrae, and neurological rupture of the brainstem, leading to instantaneous loss of consciousness and apnea. Classic asphyxial signs are not seen. This table summarizes the 3 types of hanging. Typical hanging involves full body weight and an oblique ligature above the thyroid cartilage. Partial hanging uses only head weight, often resulting in a transverse mark, and highly pronounced venous congestion. Judicial hanging utilizes kinetic drop force and body weight with a submental knot, causing instantaneous death through cervical fracture and brainstem rupture with an absence of asphyxial signs.